Indomethacin, trade name Indocin. This is a medication that you may see if you work in like a geriatric unit or you work in a place where patients are suffering from severe rheumatoid arthritis or other inflammatory disorders. So Indomethacin indication is for inflammatory disorders, like I just said, when they do not respond to other medications. The action is that it decreases pain and inflammation by inhibiting prostaglandin synthesis. It is a nonsteroidal anti-inflammatory. It's also an antirheumatic, and it can be used as an IV medication for ductus, arteriosus, patency, adjunct. Okay, so there are a lot of uses for this medication, but the main use is going to be a much stronger non-steroidal anti-inflammatory for patients who have rheumatoid arthritis and don't respond to other medications. As with other NSAIDs, it's really important that you monitor for GI bleeding. In these patients, if you take too much NSAID, you can actually develop GI bleed, so you'd want to monitor for bloody stool and for other signs of GI bleed, petechiae, and any signs of internal bleeding. If the patient takes this medication with aspirin, it may decrease the effectiveness of the indomethacin. Indomethacin can also cause photosensitivity, so a patient should wear sunscreen and protective clothing when they go outside because it can cause extreme photosensitivity. So before going outside, wear a lot of sunscreen, put some sunglasses on, hat on, and make sure that they are able to stay out of the sun as much as possible while they're taking the indomethacin. The patient should also be assessed for any sort of anaphylactic reaction. Do they develop a new rash? Do they have itching? Do they have any signs of an allergic reaction to this medication? The biggest things I want you to keep in mind here is that this is an antirheumatic, and as with other NSAIDs, you want to monitor for GI bleed, and you also want to protect against photosensitivity. So wearing protective clothing and sunscreen will help the patient stay protected. This has been another episode of the MedMaster Podcast by nrsng.com. To get our free cheat sheet covering the 50 most commonly prescribed medications, head over to nrsng.com/50meds. That's nrsng.com/50meds. Thank you so much for joining me today, and thank you for being part of the NRSNG family. We're here to help you succeed in nursing school and in life. So start your journey today over at nrsng.com/50meds. We're glad to have you aboard. You know what time it is now. It's time to go out and be your best self today. Happy nursing, y'all.